What's up, guys? Tuesdays with Taylor, episode number 9. Thanks for tuning in again this week. So, special shout out to one of our faithful followers that gave me the idea for this week's talk. So today we're going to talk about arthritis. So, most commonly, people that are above the age of 40, let's say, they have an explanation of pain, whether that be their neck pain, their back pain, their wrist, their shoulder, etc., that it's from arthritis. So this is kind of a misconception that we usually don't talk about very often, but there's actually not a lot of research that says that there's a correlation between having arthritis and having pain. In other words, just because you have arthritis doesn't mean you have to have pain. Now, this is really exciting for us because that means that there's something we can do, right? Now, we'll never get rid of the arthritis in our joints and stuff like that. We basically call that wrinkles. They're like wrinkles on the inside. In other words, if you have arthritis on the inside, it just means that you've used your body. It means that you've aged. It means that it's kind of normal tissue growth. However, sometimes it's excessive, sometimes it's a lot. There's other deep diseases like rheumatoid arthritis and different stuff like that. That's kind of a different story, a topic for another time. But just general arthritis is never really a great explanation for why you're having that neck or back pain. So my big call to action for you right now is that if you're having arthritis, or if you've been told that your arthritis is causing your pain, and you think, there's nothing I can do, I just gotta live with it. Let's think differently, right? So what happens in arthritis? So let's just say, let's take the knee, for example. So if an arthritis develops inside the knee, usually it's just because we have an unnecessary loading strategy. In other words, we're loading that joint not in the perfect way. So what we're going to try to do in the office is, number one, try to mobilize that joint so we have freely movable in all directions. Number two, teach all the muscles that are attaching around that knee how to work properly. So again, we're never going to change the bony abnormalities or the structure of the knee, but we can make all the muscles around the knee and up into the hip and the foot work so much better that we compensate around the bony abnormalities. So needless to say, there's so much we can do to help you if you do have arthritis, and we'd love it if you give us a chance. So if you or someone you know is dealing with pain that you think may be linked to arthritis, give us a chance. Maybe we can make some changes in your life that you might be a little bit surprised with. So hope you guys enjoyed today's Tuesday with Taylor. Stay tuned for next week, and we'll see you very soon.